Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available. A 22-year-old client is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago, his girlfriend broke off their engagement and canceled the wedding. Given the Diagnostic and Statistical Manual of Mental Disorders criteria for this disorder, the nurse should expect to find which data during the interview with the client. 1. Current treatment for pneumonia. 2. Regular use of alcohol or marijuana. 3. Evidence of delusions or hallucinations. 4. A history of chronic depression. The correct answer is 3. According to the criteria of the Diagnostic and Statistical Manual of Mental Disorders, a diagnosis of brief psychotic disorder is made when the client exhibits delusions, hallucinations, and disorganized speech or behaviors in the absence of a mood disorder, substance-induced disorder, or general medical condition. A client diagnosed with undifferentiated schizophrenia is being discharged on aripiprazole 5 milligrams every night. When developing the teaching plan about the most common adverse effects, which of the following should the nurse include? Select all that apply. 1. Headaches that will subside in a few weeks. 2. Transient mild anxiety. 3. Insomnia. 4. Torticollis. 5. Pill rolling movements. The correct answers are 1, 2, and 3. Headaches, transient anxiety, and insomnia are the most common adverse effects of aripiprazole. Torticollis and pill rolling are more common with the older antipsychotics. A client with pregnancy-induced hypertension is to receive magnesium sulfate to run at 3 grams per hour with normal saline to maintain the total IV rate at 125 milliliters per hour. The nurse giving end of shift report stated that the client's blood pressures have been elevated during the night. The oncoming nurse checked the client and found magnesium sulfate running at 2 grams per hour. Identify the nursing actions to be taken from first to last. 1. Notify the primary healthcare provider of the incident. 2. Assess the client's current status. 3. Correct the IV rates. 4. Initiate an incident report. The correct answer order is 3, 2, 1, and 4. The nurse should first change the IV magnesium sulfate and normal saline infusion rates, and then assess the current status of the client. The nurse should then notify the primary healthcare provider to explain the error and report the action taken. A medication error has occurred, and the nurse will need to initiate an incident report. The nurse notices that a client who has just given birth is short of breath, ashen in color, and begins to cough. She becomes limp on the birthing table. At last assessment half hour ago, her temperature was 98 degrees Fahrenheit, pulse 78 beats per minute, respiration 16 breaths per minute. Determine the nursing actions in the order they should occur. 1. Open airway using head, tilt, chin, lift. 2. Ask staff to activate emergency response system. 3. Establish unresponsiveness. 4. Give 2 breaths. 5. Begin compressions. The correct order is 3, 2, 5, 1, and 4. The client's actions indicate distress, and the nurse should initiate emergency procedures. The nurse should first establish unresponsiveness and then ask staff to activate the emergency response system. Next, the nurse should follow CABs of CPR. The nurse should check the pulse and begin CPR. Then after 30 compressions, a nurse should assure the open airway and give 2 breaths. After instruction of a prima gravida client at 8 weeks gestation about measures to overcome early morning nausea and vomiting, which of the following client statements indicates the need for additional teaching? 1. I'll eat dry crackers or toast before rising in the morning. 2. I'll drink adequate fluids separate from my meals or snacks. 3. I'll eat 2 large meals daily with frequent protein snacks. 4. I'll snack on a small amount of carbohydrates throughout the day. The correct answer is 3. The client needs further instructions when she says she should eat 2 meals a day with frequent protein snacks to decrease nausea and vomiting. The client should eat more frequent, smaller meals with frequent carbohydrate snacks to decrease nausea and vomiting. Eating dry crackers or toast before rising, consuming fluids separately from meals, and avoiding greasy or spicy foods may also help to decrease nausea and vomiting. The nurse and parents are planning for the discharge of a child with leukemia who is receiving dactinomycin and vincristine. The nurse should teach the parents to 1. Encourage increased fluid intake. 2. Keep the child out of the sun. 3. Monitor the child's heart rate. 4. Observe the child for drowsiness. The correct answer is 1. Dactinomycin and vincristine both cause nausea and vomiting. Oral fluids are encouraged, and antiemetics are given to prevent dehydration. Avoiding sun exposure is not necessary because photosensitivity is not associated with these drugs. Heart rate changes and drowsiness also are not associated with either of these 2 drugs. A client is undergoing a thoracentesis. The nurse should monitor the client during and immediately after the procedure for which of the following? Select all that apply. 1. Pneumothorax. 2. Subcutaneous emphysema. 3. Tension pneumothorax. 4. Pulmonary edema. 5. Infection. The correct answers are 1, 2, 3, 4. Following a thoracentesis, the nurse should assess the client for possible complications of procedure such as pneumothorax, tension pneumothorax, and subcutaneous emphysema, which can occur because of the needle entering the chest cavity. Pulmonary edema could occur if a large volume was aspirated, causing a significant mediastinal shift. Although infection is a possible complication, signs of infection will not be evident immediately after the procedure. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per milliliter. How many milliliters should the nurse administer? Round to 1 decimal point. Blank ml. The correct answer is 0.7 milliliters. The formula is 10 milligrams over x ml multiplied by 15 milligrams over 1 milliliter. You cross multiply, and you get 15x equal to 10. You divide by 15 on both sides. X equal to 0.666, and then you round to 0.7 milliliters. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. A client admitted with a diagnosis of schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, and olanzapine prescribed has had an increase in manic symptoms in the past week. The psychiatrist prescribes a valproic acid blood level to be drawn at once. The nurse understands the rationale for this prescription, as which of the following? 1. All clients taking valproic acid need periodic valproic acid levels drawn. 2. Fluoxetine can decrease the effectiveness of the valproic acid. 3. A decrease in the level of valproic acid could explain the increase in manic symptoms. 4. The valproic acid level is needed before a short course of lorazepam for agitation can be prescribed. The correct answer is 3. Valproic acid is commonly used to treat manic symptoms. Therefore, a decrease in the valproic acid level could explain the increase in manic symptoms. Periodic determinations of the valproic acid level are necessary to determine the effectiveness of the drug. However, the stat nature of the specimen to be drawn indicates an immediate problem. Fluoxetine is not known to decrease the effectiveness of valproic acid. The valproic acid level is not needed before beginning a short course of therapy with lorazepam.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.